Hey there, I'm Dr. Jim. Thanks for joining me for another video. This time I want to talk a little bit about an important topic, specifically in skilled nursing and assisted living facilities. It's elopement in senior care. And it does happen, and it can be very dangerous or deadly. So there is a connection between wandering and elopement. I talk a lot about wandering, not so much about elopement, but there is a difference between the two. Around 33% of residents who live in senior care, nursing homes, assisted livings, will wander at least one time during their stay. 1 out of 5 residents who are diagnosed with a type of dementia, Alzheimer's being the main one, is going to wander. 1 out of 5, 20%, they're going to wander no matter what. The problem is, wandering is a leading risk factor for elopement. And then, of course, elopement is a problem that can lead to a lot of other very dangerous issues. Wandering tends to be more of a behavioral issue, while elopement can be very dangerous and life-threatening. Okay? So wandering, it's a behavior, the residents moving about, maybe they have a place they want to go in their mind, they're confused, they're trying to get out, whatever the case is, they're sundowning. Elopement is, I am out of here, and I don't know where I'm going, but I'm going to figure it out once I get out of this building. So elopement actually means that the resident is leaving or has left, just like Elvis, the building. Most elopement takes place between 7 a.m. and 11 p.m., so that's first and second shift. One elopement, that's all it takes is one good elopement, is a predictor for another and another. So the majority of elopements occur within the first 48 hours of admission. So what does that mean? Pay attention during that first, I would say the first full week, if not more. Really pay attention to the resident. Make sure that they're adjusting. Help them with the adjustment period as much as you possibly can. So the differences between wandering and elopement: wandering refers to a confused, probably moving around, seeking the familiar, or sometimes an exploring. See, in person-centered language, I don't even like to use the word wandering. It sounds like a zombie is wandering around a building with, an aimless goal. I like exploring. It makes me feel better, and it makes a lot of other people feel better as well, because there's a much lighter connotation to the word exploring. They're exploring the environment, okay? So elopement, on the other hand, may be more purposeful. Wandering, maybe not so much. Elopement, there's a purpose behind it. It involves getting outside of a senior care center, sometimes repeatedly, and it has been called, and this is important, the most dangerous type of wandering. Okay? Elopement is the most dangerous type of wandering. Big takeaway from this short video. Cognitive impairment. Why does elopement occur? There are many risk factors. Cognitive impairment is the big one. That's the leading risk factor for elopement. Cognitive impairment and confusion, by the way, are the leading causes of elopement in senior care. There are other risk factors involving older age, poor sleep patterns, agitation, unmet needs, and inability to cope with one's new environment or surroundings. And of course, there are biochemical changes taking place. There are neurological changes taking place with the aging brain. You add in a dementia, a depression, anxiety, so on and so forth, sleep disorders. Now you've got like the perfect storm. So in closing, there's so much more to learn about this topic. This is brief, this is short, but I do write a lot of articles, and I've written an article specifically on elopement and senior care. If you want to read more about it, go to my blog, drjimcollins.com, follow the link below, and you're going to learn a lot more about other types of wandering besides the ones that I just talked about. Now, if you're a licensed healthcare professional, you like this topic and you'd like some CEUs on it and many others, check out what we have to offer by clicking the link below to our CEUs. So I'm Dr. Jim. I'm so glad you stopped by to spend some time on this topic. It's okay for the most part for seniors to wander. I really believe that there are positive benefits to wandering, but not to eloping. So be on the lookout, keep our residents safe and sound, and thank you for doing what you do out there in senior care.